I'm that person who I do everything. I've been on every diet. I exercise every single day and my weight's always fluctuating. I do the work
But nothing's happening.
Nothing's happening. Or I eat exactly like my roommate. I eat exactly the same. I'm so active and yet I change clothing sizes every couple of months. And this has often been, oh, well, you must be closet eating.
Right.
You must be lazy. You're
The
really
shame game.
right, the shame game.
Yeah.
And so that's where we start to see it. This impacts so many things. And then you see that, oh, I've been chronically depressed, chronically anxious. Bulimia. I'm sometimes seeing as this was a coping strategy I had, and then to finally understand what was underneath it is this revelation.
Wow.
But it doesn't come for a long time.
My guest today, Dr. Sarah Oreck, is a reproductive psychiatrist and founder of Mavita Health, who's changing the way we think about women's health. She believes PCOS isn't just a hormonal disorder, it's a mental health story too. We'll talk about how inflammation and insulin resistance affect brain chemistry, why so many women go undiagnosed for years, and what needs to change so emotional support becomes a part of every treatment plan.
We're finally starting to use that word inflammation. I think we're going to start to see it not in PCOS alone, but in other diagnoses that, all those autoimmune diseases that women have and men don't. Like, I think there's a misunderstanding, and we just don't know enough about how inflammation impacts us. And actually, we talk about serotonin and dopamine, but in psychiatry and in our brain, we're starting to think more about inflammation may actually be one of the core reasons for depression, anxiety, etc.
This is a conversation about more than hormones. It's about healing the whole woman, body, mind, and soul. As someone with PCOS and a family full of women with PCOS, I probably know this disorder a little bit more than I actually would like to. And there are so many different manifestations of PCOS, polycystic ovarian syndrome. But one of the ones that does not get addressed, that I'm dealing with currently with my own daughter, is the mental health component of this disorder, and how the androgens and the hormone shifting and the inflammation can actually change your mind. And what that means is issues with focus and concentration, memory, and even your emotions. And if you're thinking it's just an issue for people that are maybe in their teens or early 20s, think again. This entire issue with cognitive dysfunction and PCOS reflares as women go into perimenopause and menopause. I'm so excited about my next guest because we're going to tackle PCOS in a conversation that's not just about hormones, but about your whole body and specifically about your mind. Please join me in welcoming Dr. Oreck to the show. Okay, before we jump in, quick health check. Are you subscribed yet? You'd be surprised how many people forget the one click that actually helps them feel better every single week. Go ahead, hit it. At Whole Plus, we turn science into self-care that you can actually use. Let's get started. Dr. Oreck, welcome.
Thank you so much for having me.
We are about to talk about one of my favorite topics, partly selfishly, because I have PCOS. Our entire line of women, if you look forward or backward, has PCOS, or they had it and didn't know they had it. And I think I've seen every manifestation. And we've talked about that here on the show. We've talked about it in our clinics. We deal with it all the time. But you know what gets the most underserved or under-recognized is the cognitive and the mental health component of PCOS and the learning component of PCOS. I have a 17-year-old daughter. I am telling you, the week before her cycle, probably 2 weeks before her cycle, she's a different human, and it shows in her grades as well, So, I think that we need to shed a little bit more light on this. And what better person to bring this in? You're an integrative reproductive psychiatrist, right? Like marrying so many different fields together. How did you fall into really diving into the world of PCOS and mental health?
So it's not necessarily about PCOS, my origin story, but it's about medical gaslighting. So when I was about preteen, those really formative years, around 12 years old, my mom was in her early 40s and started to experience what we now know as perimenopause. But she had to go to like 8 to 10 doctors because everyone told her, you're too young. That doesn't make sense. And yet all of the symptoms were sort of very clear now in retrospect of what was going on. And I saw her sort of change in front of me. She all of a sudden had a bout of depression, a lot of mental health issues. So then cut to when I'm in medical school,
Right.
deciding between OB, and then I fell in love with psychiatry, and I was privileged enough to go to a residency at Columbia University in New York where they had women's reproductive mental health, where we studied how hormones and female reproductive hormones really impact the life cycle.
Wow.
And so
Yeah.
in these really big transitions, of course, the path to parenthood is one, perimenopause, but PCOS is huge. And I think I'm just seeing so many more women in their sort of adolescence into their
Hmm.
20s dealing with these issues, and yet being told a number of different things, not getting a diagnosis for a long time. And then I'm really seeing that in my private practice and finally being able to kind of give some answers to experiences they've been having for a long time.
Why do you think, and by the way, that gaslighting piece, that's what got me into this whole world. I mean, it was literally 18 months, 10 doctor visits, told I was anxious, depressed,
Yes, exactly,
stressed.
exactly.
Here's a medication for this, a medication for that,
Yes.
but I had PCOS,
Yep,
right? So,
that's
but
right.
anyhow, but why do you think that we are not paying attention to PCOS and women's health or mental health in particular? Like,
Yes.
I mean, we could even talk about PCOS because that's still not being diagnosed at
Yeah,
the rate that it should be
absolutely.
being diagnosed. But why do we think we're missing it? Why are clinicians missing it? Why are, patients missing it and understanding that interconnectedness? What's going
No,
on there?
100%. I think we know so little about women's health.
Facts.
Women weren't in clinical studies until the 90s. Like, there's just so much that's missing.
Yeah.
And I think we're finally at the stage of like, we kind of start to understand this, but we need so much more research and funding. But it starts from the beginning. Do you remember PCOS being a huge thing in
No,
medical school, like, or in any of
no,
your training?
no,
No.
not at all.
And so that's exactly right. Like, I don't even think OBGYNs are getting that much exposure to
Right.
here's how you diagnose and here's. So I think it's a failing in our education. And also, I think there's a problem with the education of and people's health literacy around their menstrual periods, right? What that means. And you'll even see that there's not that many people that understand how the length of their cycles or what that even means. They think it's like the number of days you have your menstrual
Right.
period. And so I think there's so much in terms of education, both from a medical perspective, but also from just the lay public.
Correct. And then I think too, like some of the treatment options, like birth control pills or, spironolactone or some of these things that are traditionally used in PCOS, like mask,
Yes.
like the mental health component too, So it's like
And
this,
sometimes they make it better,
and sometimes
sometimes
they
they make
make
it
it
worse.
worse.
That's right.
Yeah,
That's right.
absolutely. So,
And there isn't enough validation. And I think this is why I feel like this is a really important moment of like, yes, there's symptoms of PCOS that can affect your fertility, that can affect whether your cycle comes on time or what those cycle lengths are
right.
like. But there's also individual, independent mental health issues that need to be
So
addressed.
let's talk about those. What are you seeing both in research and in your, exam rooms when it comes to women with PCOS and mental health? What's happening?
I'm seeing that the women who are dealing with this, and again, it's hard to parse out. Is it because you have all these other medical symptoms and
Right.
all this medical gaslighting and you're not getting answers? But I'm seeing rates about 4 times as much in someone without PCOS increase in depression. So 4 times the amount of depression, 5 times the amount of anxiety.
5 times the amount of
Yes,
anxiety.
and I think there's actually, right, a biological mechanism to this, and I think we're finally starting to use that word inflammation.
Yes, thank you.
But I do think that, and I think we're gonna start to see it, not in PCOS alone, but in other diagnoses that, oh, all those autoimmune diseases that women have and men don't.
Mhm.
Like, I think there's a misunderstanding, and we just don't know enough about how inflammation impacts us. And actually, we talk about serotonin and
Right.
dopamine, but in psychiatry and in our brain, we're starting to think more about inflammation may actually be one of the core reasons for depression, anxiety,
Absolutely,
etc.
absolutely, and in our integrative world, we think of depression and anxiety as neuroinflammatory conditions,
Absolutely.
right? Where the brain is literally on fire for different reasons,
Yes,
and it's different for everybody, but,
that's right.
so when these patients are coming in, like, is it anxiety dominant? Is it depression dominant? Like, how are you able to diagnose it? Do you check hormone levels and compare it to that? Like, what are you seeing there?
It's varied. So I think obviously I see a lot of people because I focus on female reproductive hormones that are trying to become pregnant.
Right. Okay.
And so that path to fertility honestly, and I don't know if you agree, is sometimes the first time people kind of get this diagnosis.
Oh, totally.
Right.
100%
Because like
agree.
there's no
Yeah.
other,
There's
like,
no other reason,
I mean,
so.
people have complaints, but they dismiss them.
Right.
Oh, you're just young. Your cycle
Acne's
hasn't been
normal.
regular. Acne's normal in a teenage girl, all that stuff. And so this is the first time that I think people are getting these diagnoses. I'm seeing these diagnoses increase throughout my career. I think there's also some exogenous, like that we can't control for. Obviously, there's endocrine disruptors in our every day
Correct.
that may be contributing to this. But I am seeing more of a diagnosis there. And what I notice is I'm that person who I do everything. I've been on every diet. I exercise every single day and my weight's always fluctuating. That's also another reason outside of the fertility that people
Yes,
sometimes,
for
right?
sure. Yeah.
Like I'm the person who I do the work
But
and
nothing's happening.
nothing's happening. Or I eat exactly like my roommate. I sometimes in younger women, I eat exactly the same. I'm so active and yet I change clothing sizes every couple of months. And this has often been, oh, well, you must be closet eating.
Right.
You must be lazy. You're
The
really
shame
not
game.
right, the shame game.
Yeah.
And so that's where we start to see it. And I think this impacts so many things. And then you see that, oh, then there's this, oh, I've been chronically depressed, chronically anxious. Bulimia. I'm sometimes seeing as oh, this was a coping strategy I had. And then to finally understand what was underneath it is this revelation. But
Wow.
it doesn't come for a long time.
Right. And again, I shared with you that I have a teenager and I've definitely seen the ups and downs mentally
Yes.
with her hormones. Right.
Absolutely.
And then I see it in our patients too, right? Same thing. How are you checking hormone levels? Is there a hormone pattern people should be? Is it the blood sugar component of PCOS? Is it the androgenic component? Is it the estrogen dominance? Like what?
Yes.
Help us. Like
So
what's going on?
we are checking labs. Sometimes, of course, they're under the care of a reproductive endocrinologist. So that's sort of, someone else is taking care of that.
Right.
But I am seeing sort of these high levels of testosterone that no one's ever checked.
Right.
I actually had a patient recently who came to me, had the story of fluctuating weight, anxiety, and depression. And she's young, so it's been, oh, you have anxiety and depression.
Right.
So does,
Right.
most of your peers.
Right.
Fluctuate, kind of very irregular periods, had a really high testosterone for about like 2 years that her doctor
How old was
just
she?
sat on. Early 20s.
Early 20s. Yeah.
And just sat on it. Looks like it might be normal. Obviously, the male pattern sort of hair growth and hair loss. And, it's those things that are like just challenging to see that it's kind of ignored by a lot of clinicians. So I like to look at testosterone. I think
Okay.
sometimes that gives us some, but obviously I think getting the ultrasound and how you're diagnosing it is that Rotterdam diagnosis. We can talk about that, the
Right.
2 to 3 kind of categories. What's really interesting is the name is even a misnomer.
Right. Tell us about that. Well, tell us about the Rotterdam. Let's go there. Talk to us about the criteria for diagnosis.
Yes.
And there was a recent report that updated the criteria. It's not that recent. I think it was like 2 years ago, the 2023 or 2022. There was some sort of updated report on how to diagnose PCOS. I'm blanking on the organization that did it. But it segmented PCOS diagnostics by race, and how
that's
there's a
interesting.
racial,
Components
sort
or
of components to
different
it.
story.
But I don't think, I'll have to go back and look at it. I don't think it talked about mental health. I think it
No,
talked
they
about
still don't talk
weight.
about mental health. It's
It talked about fertility. It talked about cycles, and anovulatory cycles
Yes.
and all that business, missing your cycle.
hyperandrogenism.
Hyperandrogen.
Right.
I don't think it talked about the cognitive or
I can
the
see
mental
that.
health component
No,
of
I
it.
don't. Yeah, I
So,
don't
but
think
anyhow,
I haven't seen that as any of the components. So really, what we're looking for is hyperandrogenism. This is this increased sort of male testosterone, but again, women also have testosterone. It's
Right.
just kind of a misnomer. And you kind of start to see the acne, the hair growth that is kind of unusual for women, and the male pattern hair loss, frankly.
Yeah.
That weight gain that's sort of in that middle area. And what's interesting is when you do an ultrasound, what you're looking for, and it's polycystic ovarian, but
Right.
what we're actually seeing is follicles.
Right.
So it's just a lot more follicles than you would see typically. But even that that it has
That's why that
a
high
misnomer.
AMH is like, I'll look for a high AMH.
Oh, that's interesting.
Versus just, AMH, is usually used for fertility,
Yes,
right?
exactly
Okay, yeah,
right.
you have eggs, but if it's too high, That's a sign to me of PCOS as well
Oh,
too.
that's a great tidbit. I don't
Yeah.
usually do any ambitious,
Right. You're right.
but absolutely. So I think, those things are all significant. But again, it's hard to kind of pin down this diagnosis. Also, people, unless they're using a cycle tracker, like, aren't tracking their
Right.
periods necessarily. Sometimes people don't know, or they've been on birth control for so long that they had no idea if
Yeah.
they're anovulatory or not.
Yeah.
So I think that there are these significant sort of systemic challenges.
So one of the biggest things with the weight component of this, right, is the blood sugar instability. And I feel like one of the ways I've been able to pick it up too is just like reactive hypoglycemia, right? Somebody whose blood sugar is just maybe not necessarily high.
Yeah.
Everyone's always looking for like the
And
high
that's hard.
number,
Yeah, yeah.
and it's not necessarily
And you don't
high.
necessarily see that.
It's
Yes.
just up, down, up, down, up, down. It's not their diet. Like they're not doing anything wrong,
No.
So that's another one. How is insulin and inflammation and blood sugar tied to the mental health component
Oh,
of
this yeah,
PCOS?
this is great. I think people think of insulin so much as just like what your body does,
Right.
and they kind of disconnect that your brain is so highly influenced by insulin. So I thought it was really interesting that you mentioned before we started,
Mhm.
and I don't know if you're okay with me
Yeah,
sharing the
yeah, jump
anecdote
in.
about your
Yeah,
daughter
yeah.
of like cognitively or in her like tests or the kind of what she's doing at school, you can see that there's a difference
Right.
in these really vulnerable times for her. And I think what we're seeing is that insulin sensitivity impacts your brain function. And so when you're not, and when you're insulin resistant, that impacts how you're cognitively doing. And we actually think that that cascades down to the kind of neurotransmitters your brain is actually producing. And again, mental health is way more complex,
Right.
and depression and anxiety is not just serotonin syndrome.
Right.
It's all these circuits, but all of these things working together is really important. And we also forget how much female reproductive hormones actually impact serotonin production. And then that downstream really impacts our moods. Like, it's no surprise that women have much higher rates of depression or anxiety during their reproductive lives.
Mm.
And I think that's always kind of forgotten. But without even a diagnosis of PCOS, our rates of depression and anxiety are 2 times men. We only sort of start to have the same rates of mental health issues once we're postmenopausal.
Postmenopause, yeah.
And yet we have these huge times. And I think PCOS is going to be this next, I think the next space where people really start to pay attention with mental health, especially because we're starting to see, and I've seen this with GLP-1s. I don't know if we're going to go here.
We can go
We can
anywhere.
go here.
We can go there.
So I've started to see just the impacts it makes not only on weight, but on mood.
Mm. What are you saying?
When it's even secondary to it, but, "Oh, I don't have all these food thoughts anymore," or this sort of obsession and compulsion around it. But even independent of that, there's just not as much noise in terms of depression and anxiety.
Do you think it's stabilizing the blood sugar and
I do.
reducing the
I really do.
inflammation, and
Yes,
then it's taking down the
absolutely.
anxiety and the
Or once you don't have that insulin resistance, your brain is sort of firing on all cylinders.
yeah.
You're able to make all of those neurotransmitters that you need. And so it's this really interesting phenomenon where I've had people start GLP-1s and all of a sudden they're not on SSRI anymore.
Fascinating. So, okay, we have to talk about cortisol.
Yes.
What's your sense of
Cortisol is getting like
cortisol?
hot right now.
It just cortisol, and I have, again, a motivation for asking this question, but cortisol, along with insulin and its role in PCOS, how does that fit into I call it the PCOS triangle. How does that fit into it?
Into the kind of mental health aspects. I
Mhm.
mean, listen, we've kind of known for a while that cortisol is so impactful in terms of anxiety symptoms, panic symptoms, right? It's really that hormone that kind of spikes in us when we have that fight or flight sensation.
Yeah.
And women so much of the time are experiencing that. And so for me, it's like, of course, this fits into that inflammatory picture. And I think it's worsening mood symptoms. But
Mhm.
I'm also kind of thinking about how our nervous systems, because of some of the things that we're exposed to,
Yeah.
some of the social media, is already kind of worsening that. So, kind of independently and dependent on that, I think all of our cortisol levels are being deeply
Totally
impacted and
taxed.
rewired.
So I want to ask you another selfish question. And I promise I'm going to show you where I'm going with this. But do you think that the diagnosis of PCOS is on the rise, or do you think the occurrence of PCOS is on the rise? Do you think we're seeing more of it, or do we just know more about
I
it?
know. It's a little bit like autism spectrum
Right,
disorder where it's like, which is it? Are we getting a little bit better at diagnosing? I think we're getting a lot better, and I'm so happy about, like, a podcast like this
right,
because someone hears it and says, "Hmm, I've had weight issues. I've had these menstrual irregularities. I'm having anxiety and depression and cognitive issues. Like, maybe this is me." And I
right.
think people are seeking out, "Hey, I wanna find out,
The
the
answers,
answers,"
right.
right? So I think that's really exciting, and I think that's part of it. But I also think that there's some sort of, environmental toxins
Something
here,
going
yes,
on. Yeah,
where we're
yeah.
impacting fertility rates.
Big time,
Yeah,
yeah.
I think we have a lot of endocrine disruptors in our midst, and I do think it's impacting, processed foods we think impact a lot of this. So I do think it's probably both, frankly.
Well, it's interesting to me on so many fronts, again, personally, and then even if you look at South Asians, apparently like 75% of women have some form of PCOS in that community because
Oh,
they have such bad insulin resistance for whatever reason.
reason,
I don't
yeah.
know what the
Yeah, or
origins of
yeah.
that are. But the study that really, and this is another one that just recently I saw, and it was fascinating to me, but it was actually from Placenta, the journal, and it was talking about prenatal exposure to cortisol
Mm,
and androgens
mhm.
increases childhood behavioral disturbances. Well, before they even got to childhood, they talked about colic
Yep,
and irritability in the infant, and
100%.
then the behavioral component
Yes.
for the child, and then poor, the language again, I'm going to misquote it, but poor ability to externalize feelings, aka anxiety and depression, as they moved into puberty. And tying it back to the prenatal or the preconception environment,
Yes.
separately, if you look at studies, you see the studies on all the different chemicals, the phthalates,
Mhm.
you know, all the stuff basically, and how that is influencing a more androgenic, hyperandrogenic environment, or sort of a stored estrogen environment.
Yeah.
The two are often linked together. Are you seeing some of that in clinic?
I'm certainly seeing, and it's hard to tell because, of
Right,
course, a previous generation,
right. They didn't
there
test
there
all
was
this
Brooke
stuff.
Shields also talking about postpartum depression. People don't really even understand that some mental health issues occur during pregnancy.
Yeah,
And so this is why we in our field, in reproductive psychiatry, we're always a proponent of, hey, if it starts in pregnancy and there's untreated mental health issues, that affects the baby.
yeah.
But so often people are just so preoccupied with, I've got to do the best. I've got to not take this. I've got to not do
Wait,
that.
let's talk about that though. What is the connect? Okay, so Chinese medicine is passionate about not passionate, but they've like are founded in this idea of the mom-child connection, right? Health of the mom is connected to the health of the child. What is that connection when the mental health of the mom, beyond what we know, like maybe the mom's not going to be engaged and stuff like that? Is
Yes.
there another connection between what's going on with the mom and her mental health and the unborn baby?
Yeah. So actually, it's connected to cortisol.
Mm, we're back
So
to
when
cortisol.
back to cortisol,
Mhm.
when we are having sort of these big reactions, anxiety, panic, people often think just medications get to babies,
Right.
but no, your hormone levels, your cortisol levels, those
Are
are all
getting to the
transferred through
baby.
the placenta and to your child. And ultimately, that's where we see some neurobehavioral issues in children, independent of anything that mom did, right? Just that she had untreated symptoms that weren't addressed. This is why it's so important to kind of get that care,
Yeah.
whether it's therapy or just support, so you can get through this pregnancy and have the best outcome. But often people are just so worried about, if I have to take a medication during pregnancy,
Right.
am I going to impact your child? And actually, the answer is you not having, you having the best health possible and the most optimal health is going to be the best for your baby.
So for, I guess, any pregnant mom out there or any young woman thinking about
Yes.
getting pregnant, right? Like thinking about your mental health
Oh,
and understanding where you are, and if it is changing as these
yes.
hormone surges are taking
Because of course
place,
they're gonna
they're going to
change.
change,
Your hormones are
So,
increasing, your sex hormones like estrogen are increasing to levels that they never have in your entire life. And then they're gonna plummet to a level they never have in the shortest amount of time, in the postpartum. So it really is a very, very impactful time. But I think we have this perception of somehow you're pregnant, so you're going to be in this like
Happy, happy
happy and it's
joy.
this wonderful thing.
Right.
But I think for most of us that have been through it, know that it's not all
No,
rainbows and butterflies.
not at all. Do you treat the PCOS pregnant mom differently than another mom?
That's interesting. I think the PCOS moms have typically had a long fertility journey.
Yeah. True.
And so that I treat everyone who's had a long fertility journey almost like I say, it's not just this pregnancy. You know, you've been pregnant in some ways for all of this time that
Right.
you've been thinking about this baby, doing all of these procedures. So their, prenatal period is sometimes 2 to 3 years, and that's
Wow.
really impactful, right? By the time you do an egg retrieval or you get to IVF, right? They may try to do IUIs first, and then
Right.
which is intrauterine insemination, and then in vitro fertilization. It's a long, arduous task.
Very. So for those women, what's their path? What do you recommend
I
to
think
them?
it's a lot of support. I always say a village is so important. There's so many women that are dealing with similar
Yes.
things. And if it's not necessarily PCOS, trust me, a woman has been gaslit in her medical sort of journey
Journey. Yep.
somewhere in
Yep.
there. Like, do
I always
not worry.
say, if
You
it's not
have
PCOS, it's endometriosis.
it's
And actually, the
endometriosis.
two go
Yes,
together.
yes,
So,
yes. Oh
so
my
it's
God.
one
I
of the
think
two.
endometriosis
Yeah.
is also this next,
Right.
so many connections with mental health as well. And sadly, needs to have better diagnostic
I know.
tools. I mean, that a surgery is the diagnostic
It's
tool. It's
ridiculous.
ridiculous.
Yeah.
So I think very similar in this way, like you will find partners, and more of us are struggling in this way. And I think, I think that village is really, really important in this time, and going to sources that you're going to get evidence-based care from. Because again, there's a lot of noise right now.
How does somebody know where to go though? Because there's a lot, just on social media, there's a lot everywhere, you know.
And I don't know what your experience has been, but I've seen a lot of dismissal of PCOS by
Oh, all
OBGYNs.
the time.
Yeah.
All the time in our clinic. In
And
fact,
that's like the specialist you would think to go to. Same with endometriosis, actually.
well, we still see like, oh, you don't have cyst on your ovaries.
You're not,
You don't have
have,
PCOS.
yes,
We
yes,
still
yes,
see that. I have
yes.
patients come back and
But
say that
that's
all the
not,
time.
right, that's
So,
one of the potential diagnostic criteria, but you don't need to hit that.
right, exactly. So we see that and we see a lot of it missed. But again, for somebody with who's having the mental health component of it, I guess it's twofold. Like, what does the patient need to understand? And what do we, the clinicians, need to understand? We each probably need a checklist of some kind to be like, okay,
Yes.
this is the conversation we need to be having, and then we can get into kind of like, okay, now that we're on the same page and we agree that whatever's happening is because of PCOS and the hormonal,
Here's what we can do.
here's what we need to do. So help us through that.
Yeah, so I think this is why I created the company that I created
Yeah.
called Mavita Health,
Okay.
because I wanted to scale what I did, which was really small. So I
Mhm.
had a private practice, and most of the people who are like me, reproductive psychiatrists, there's only 15 programs in this country.
Oh, wow.
Graduate maybe 1 or 2 medical doctors a year. That's not enough people for all the women that need
Mhm.
this type of care. And so what I wanted to do with Mavita is really be able to scale it and then teach all of the clinicians that we employ about all of these reproductive mental health issues. And we ask all of our patients about their cycles. What was your first period like? What is your cycle length?
Right.
Do you have any other diagnoses? Oh, you have male pattern hair growth. Oh, you have a lot of acne. And we start to put the pieces together because we think that's essential to the mental health treatment. So it's even like, can we start taking histories
That are better.
that are better? Like for any mental health care, of course I'm biased, but I
Right.
think you should, if you're a woman's in front of you, how come you're not asking how
A
many
hormone
times she's been
history.
pregnant? Right,
Yeah.
hormone history. And it's just not happening. A lot of people will say, I went to a psychiatrist and they never asked me anything. They don't know how many times I've been pregnant. They don't know if I have PCOS. And then starting to put that picture together, because you can't just give medications and
Right.
just therapy alone for PCOS. You have to have the other treatments. But I think it's the education that for us is kind of what we're really working on, where we start to lay the foundation of like, these things are interconnected. They're not really that independent from each other.
Are there screening checklists that a provider could put into place within their clinic
I
to
would
be
love
like,
that
just like we have,
for
for
like, yeah,
teenagers,
yeah,
and you have the
or postpartum
GAD-7, and you
depression.
have the
Yes,
postpartum
yes.
eating disorder. We have these established screening, criteria that we'll use in practice. Like, I don't think we have an established one for
But
PCOS.
what does that require? That requires clinical
Agreement
study
and
and
consensus,
consensus
and
and
yeah,
clinical
yeah,
study and
yeah.
also validation of those screening tools.
True, yeah.
But I think that, right, that's a fabulous idea.
So let's take it forward. So we all agree, we're in the exam room, we all agree that this is hormone-based, androgenic, insulin, blood sugar-based, cortisol-based,
Yes.
anxiety, depression, even bipolar sometimes, OCD, all these different things. What's the next step?
So, from a mental health perspective, we make sure that you are kind of connecting with that treatment team that can help, though it's hard to find.
Right.
Because I said sometimes we have people bouncing around different OBs who are like, man, go, I'm like, you're fine. And so then what we say is like, let's help you in this kind of discipline or this area. Let's help you with the mental health aspects, but always kind of thinking about, okay, do you want to try hormonal birth control? Do you want to try spironolactone? Like, what are all? Because I think it's a interdisciplinary issue,
Mhm.
and I think too much of the time, like, we haven't been doing that. And so we certainly talk about evidence-based supplements that we like and we want to integrate. But, I really wish that there was more openness and discussion about this. And I think education for clinicians as well.
What are some of the best supplements for somebody with PCOS who's starting to have, some of these mental health symptoms?
Yeah, there's some small research about inositol.
Yeah.
And, some people do well with it. I think what's difficult with supplements generally is the lack of
Right.
regulation
Right, right, right.
and lack of consistency
Right.
between products.
Brands and
Yeah.
yeah.
Is there something you like to use in particular?
We have a couple of brands that we stick to a couple of brands, first of all. Patients will often deviate from that and try to find comparable, but we have brands that we trust and that we use. I use saw palmetto
Mhm.
to block the androgens. I've actually, and I'm so curious what you think about this, but I've started using Deplin or methylfolate
Yeah.
to help the anxiety and the depressive component of it.
Well, what's really interesting is that we sometimes see that people have some deficiencies,
Mhm.
and it can actually help, even if they're on an SSRI,
Right.
help improve the effectiveness of
Of the
that SSRI.
medication.
Yeah,
Yeah. So
exactly right.
that's a big one for us. And then magnesium
We love
was
magnesium.
probably, those are probably my top three. And after that, it gets very individualized. Some of the individualization that we do ties also back to the microbiome.
Yes. Oh,
Is
we didn't talk about
No,
that, but that's a
that's what I
great
wanted to ask you. Yeah, I
conversation.
wanna ask you about that because I'll tell you what I see in practice, but I'm curious what you're
Yeah,
seeing in the research
yeah.
and, like, what's evolving in the field of psychiatry. What I see in practice, and I've talked about this before, is that there is a microbial shift in PCOS for sure, and then there's
Less
also
diversity is what we're seeing,
and
right.
then there's another microbial shift if you get pregnant, if you do IVF, if you
Yep,
do any of these things,
yep.
right? The pattern that we're seeing is usually a skewing towards candida or
Mhm,
overgrowth of yeast in the
mhm,
gut.
mhm.
And so the cognitive component that kind of ties in with that is, of course, tied to blood sugar because
Yes.
candida and blood sugar are so interconnected, right? But it is the brain fog. So when people have a candida overload, it's like the brain fog. Sometimes it's depression, processing issues, like a lot of these different things.
Yes.
That's what I see in the exam room. When I go to research, and I haven't gone recently to look at the microbiome in particular with PCOS, I don't see a lot.
Yeah.
So I'm curious what you
I
know
think that
of.
some small studies I've been seeing, and certainly, like, if we back up,
Right.
the gut is a really interesting
Yeah.
kind of, yet to be tapped into area for psychiatry.
Yeah. True.
So we
Yeah.
think about how there's so many, especially in the anxiety disorders, connection with the gut.
Yeah.
Oh, I get really like not like the butterflies in my stomach. There is a brain gut connection. And in fact, when we start a serotonergic agent, for example, we say you may have some effects on the gut. And guess what? Because you have so many serotonin receptors in your gut.
Right.
And so there have been really interesting kind of studies in psychiatry where they start to do transplants of
Mm.
fecal
Oh,
transplants and
yeah.
all sorts of things to actually help with mental health issues. But
Interesting.
here, what I've been seeing is that there starts to be less diverse microbiome in the gut of people who have PCOS. And again, what we think is a healthy microbiome, we are all made up of bacteria. I know
Right.
that's really gross to think
Right.
about, but that's all
Facts.
we are.
It's
Those are
facts.
facts.
Yep.
And when you have more diverse microbiome and not an overgrowth of a particular one, we think about that as sort of a healthier gut. And we do see, and again, very early on, I think we just need so much more research on this, that of course that microbiome is going to impact your brain health as well.
Do you ever see psychiatry evolving to, let me take a look at your microbiome. Let me take
I
a look
hope
at your
so.
nutrients. Let me take a look at some of this.
I hope so.
And can we see a shift from the standpoint of a lot of mental health conditions?
I mean, we already see it in women of like, we can't continue to um, isolate care by systems,
Right.
by like organ
Right. That's the
systems.
failure.
That's the
Right.
failure where
Right.
it's like, I only take care of this. And I'm like, but this is so interconnected.
Yeah.
And so I'm really hopeful, though I'm less hopeful because of the lack of research and the cutting of funds. But I'm really hopeful that in some time we can get to a much more personalized
Right. Approach to all of
approach to
this.
medicine, but also realize like there's no way to disconnect the ovaries from the brain, from the gut. And I think we're seeing this in PCOS. So I'm really excited about certainly what we're doing at Mavita to try to kind of improve at least the education, the understanding of what's happening, and then trying to connect the dots. But I think we all have to do a lot of work. And I'm hoping that we can do it ahead of people being so I think, disenfranchised by the
Right.
medical system and then
Right.
turning to pseudoscience or
Right.
anti-evidence base.
Well, let's talk about it. You and I are both passionate about integrative care. So, and that's the merging of sort of these two worlds together in a thoughtful and
Yes,
logical way, right?
absolutely.
And trying to both use the patient's experience and the patient's journey and what
Always as
their
the expert. Yeah.
labs say as the evidence, and then marrying that to like all the stuff that's out there. So, if we have, and we can break it up into groups, like if we have a teenager with PCOS experiencing mental health issues, what's the right integrative approach there? If we have a younger woman who's gone, as you've said, through this very grueling in observation fertility journey, what's the mental health, integrative mental health approach there, right? And then let's move into the postpartum period too, because there's yet another shift happening there too. So let's walk through those three phases maybe of the dominant mental health condition, what the right integrative approach is, and how we can help people listening and watching
Oh,
today.
absolutely. So for each of these, I actually don't think they're that different in
Okay.
terms of how I would approach them, but my take would always be you can't divorce the context either. Even if it's PCOS is the kind of etiology or the reasoning for a lot of these things happening, the person still lives in a context. They
Right.
still live in a sort of social environment. They still have peers, they still have parents, they still have loved ones. And so our approach is always this really holistic approach of tell me what's happening in your life in
Right.
addition to your body, because I think they're so interconnected.
Yeah.
And those that have more support may fare better, even if they have difficult symptoms. But if someone in their life is invalidating their symptoms, is not helping them get the care, I can imagine that must be much harder.
Horrible.
Right?
Yeah.
Horrible.
Yeah.
So for us, it's context. For us, it's we love sort of some Eastern philosophies around mindfulness. This is why our evidence-based therapy is actually called ACT. It's called acceptance and commitment therapy, which doesn't mean you accept everything that's coming to you and you just don't do anything about it. But it means, okay, I'm able to kind of confront that this is my reality and I'm able to take values aligned actions. And this is really important because then you have a nice lens when you are going to specialists of like, that's not aligning with my values. I'm not being listened to. Maybe this isn't the right place for me. And unfortunately, we're still at a place where people more often than not, because they don't get to go to, you necessarily or to Mavita Health,
Right.
where they're still going to encounter someone discounting their symptoms, someone invalidating their symptoms. And so for us, it starts there with like how people start to see themselves, the importance of their story and their narrative, and that their narrative matters. And then applying that And we meet patients where they're at. Supplements I wish were regulated
Right.
and had more evidence base.
Right.
I'm like, let's do the studies.
Right.
But there's no incentive to do studies
Right.
because you can
Right.
you can just access them. And so I think if that's where you want to go, we meet you where you're at. If that doesn't sort of fall into your values and you'd rather try the more traditional approaches, we'll meet you there too. And I think it's really important that your physicians also meet you where there's at, and to integrate things that are helpful. Like I went through IVF and I loved acupuncture every
Yeah.
week.
Yeah.
And that was really important to me. And it helped with my anxiety, actually helped with my nausea
Yeah.
more than any of the Western medicines that I was also taking.
Well, I think too, it's important for everybody to understand. Again, the show, we both take a holistic approach. The show is called Whole Plus, but we don't, and I think I can speak for you, but we don't want people parking on, I'm not doing any of that. I'm
Yes.
only doing this, or
It's
I'm only over here, and I'm not. It's like
coming
it's the
together.
coming together. Like if you've gone the supplement route, the therapy route, right? And you have a mental health issue, you have anxiety and all this other stuff. I think it's important for people to understand that talk therapy when you have hormone shifts is only going to get you so
Oh,
far,
yeah.
right?
Yeah.
So if you've done that and it hasn't worked, and you've tried supplements and it hasn't worked, but you are like struggling on the
Yes.
inside.
Yes, that there's no shame in kind of
Right.
turning to, but we have this kind of, social media is so wonderful in so many ways because it gives you access to things and it lets you see things you've never seen, but it also lets you see sort of the dark
Right.
side of things.
Yeah.
And when you start to see this really world in a really binary way,
Yeah.
the black and white,
Right.
the birth control is bad. No, it's not.
Right.
Birth
It's
control
extremes
is
for everything.
extremes.
Yeah.
And so I think it's really how, and you keep saying it, but it's integration. It's integrating all of the tools that we have to try to help you. All the tools may not apply to you, but I think knowing that they're there and they exist is important. And also, but I think that openness also needs to come from the
Yeah.
medical field.
Definitely. So for staying now with our teenagers and our younger women, if they're on birth control, maybe for birth control, like truly for birth control, not for hormone regulation.
Right.
Does that take care of the mental health component of all this stuff? Is that what you've seen?
Sometimes it does,
Okay.
and sometimes it doesn't.
Mhm.
Sometimes it worsens it.
Yeah.
And I think it's, but that's not a question necessarily an OB will ask.
Right.
Oh, you're just a teenager. What are you gonna do? Like, of course you're flexible, but I think if we can kind of empower people to say, oh, let me take this journal. I've been feeling really poorly for like 3 weeks out of the month.
Right.
Like, I don't think that's a great outcome.
Right.
Or being honest about, I'm really lack motivation, or I'm not doing well in school during the 2 week, during a certain time in the month. Like, I think that's important. And then I think for physicians and clinicians to take it seriously.
What do you want the young woman or the mom going through IVF and IUI, or now she's pregnant? What do you want her to do?
In terms of, getting that, I think getting the holistic treatment means, right, checking in with how you're feeling, getting that context. And also, you know, um, certainly being with a practitioner that you feel like hears you and sees you, etc.
So getting that team.
Getting that team,
Yeah.
because those women who have maybe struggled with PCOS their entire life, gone through fertility treatment, that's like a lot of medical back and forth.
Mm-hmm.
I wish for them to have a really smooth pregnancy and birth. You even talk about birth trauma, but birth trauma can feel like one of the most challenging. Often, I think sometimes the place where women feel most invalidated is that they're most vulnerable when they're giving birth.
Wait, what do you mean by that?
Just that they're not listened to potentially
During the delivery?
Yeah, not feeling not cared for. Not like they're like a person in the room, like a member of the team.
Right.
I can't tell you how many women come to us where like something really scary was happening, no one was communicating. Of course, the team had to,
Act. Right.
and like you had a hemorrhage and but like I think it's important for someone on the team to realize that there's a human being there
Yeah.
that needs to kind of understand what's happening in the narrative. And often with traumatic births, we build that narrative after. Here's what happened. Here's how I'm finally kind of understanding it, putting the pieces together. But I think ultimately it's about, you deserve a team that hears you and sees you and validates you. And I think that's the core of, so many of women's mental health issues.
So you said the word narrative a few times.
Mhm.
Is a part of what we all can do, what's actionable, even in the current medical climate and everything happening, is really tell our story in a way that's not like blaming ourselves all the time and
100%.
shameful. Is
Yes.
that like the first
Yes,
step
and in some
for
ways, that's what our
everyone?
therapy is. When we suspect a PCOS diagnosis, we're looking at labs, but we want to then empower that patient to say, "Here's what's actually happening.
Right.
Here's how I'm gonna tell my story." And we even sometimes practice, how I'm gonna talk to my OB about what's going on."
So you literally rehearse it
Yeah,
like you were about to act in a
yeah,
play
yeah,
or something like
yeah,
that.
yeah,
That's brilliant.
yeah. It's this really, like, unfortunately, we have to be there. I wish it wasn't the
I
case.
know, but it's just we're 1993. I was looking at the
I know.
stat the other day.
Oh, the
I'm like,
clinical studies? Yeah, I
yes,
know.
that's when women entered clinical. That's when I entered med school.
Yeah, that's
Why am I acting surprised
I know.
that I went on a gaslighting journey or so
Well,
many
oh,
of us
you
have
were
gone
just
on,
taught
So yeah,
about evidence that was about men.
right. And told to stay between these two lines, you
Yeah,
know what I
and
mean? So it's almost funny now.
to
So
be clear why
yeah,
we were, excluded from clinical trials, and I just love this because it brings it back full circle,
right, right,
is because of menstruation.
right.
Because
Hormones were confusing and messed up studies.
they confounded
Yeah.
studies.
That's the word, right, you're right. It was
Right? Like,
confounding.
that
Hormones are
isn't
confounding.
that
Yeah,
so
yeah,
of course, if our hormones confound things, well, of course, they have unique ways of behaving that sort of are essential to this, but I do think if you are listening to this and you have a young daughter or even yourself, like, you can write down, "Here's actually what I've experienced
yeah,
throughout my life in terms of my symptoms," and be clear that this is what your experience is, and if someone invalidates that, they're not the right doctor for you.
yeah. So telling your story to yourself, rewriting your narrative, taking the shame and the blame out of
Oh,
it,
yeah.
universal
Oh, with weight
across
fluctuations, that's so prevalent.
so prevalent. And then we need to go there too. There's the eating disorder component of it. Have you seen a lot of that with PCOS? And what's the
Oh,
tie-in
I see a lot of and
there?
I think what I've seen is a lot of bulimia,
Yeah.
frankly.
Talk about
Yeah,
that for a second.
so what I have noticed is and it's interesting because I think there's gonna be a schism,
Mhm.
like a division between the eating disorder world and this sort of ideas that we have around PCOS and
Right.
inflammatory.
Right.
Because my theory is these women have had this from the time that they started to menstruate
Yep.
and have developed these symptoms, and that insulin resistance, et cetera, has been part of the contributing factor for the weight fluctuations that then kind of get people to think, well, how the heck am I going to cope with this? Because
Right.
and listen, there's societal expectations that we need to talk about and address, of
Right.
course,
Right.
but I'm expected to look a certain way, be a certain size. And here I am. I eat everything I'm supposed to. I exercise, and yet I'm not able to do that. Hey,
Yeah.
what? I wonder what I could do. Right? And then you get into maladaptive
Behaviors.
behaviors like purging or over exercising or all of these things. Right?
Restricting.
Exactly.
Yeah.
And so I think you see this in older women who have been that person who's been on every single diet, has been low weights, high weights, et cetera.
Patients like that.
Yeah. Like and it's this constant gaslighting of it's your fault. You're just not doing it right.
Mhm.
And I think what we're going to end up probably unmasking is that a lot of these sort of potential binge purge disorders like bulimia nervosa may have its origins in potentially, right, a PCOS, or
Mm.
maybe this is the origin story. This is how this sort of starts to bubble up because society has expectations. My
Right.
body isn't fitting them. What should I do?
Right. And it's the cortisol and the other things driving it, 100%. How do we treat those people?
I know it's hard. It's hard. I wish we could intervene before
Yeah.
the maladaptive behaviors start.
Right.
And so I think we've done a good job, and I don't know how you feel about this, but there has been this shift in body positivity.
Yeah.
Eh, you have a teenager, so
Ish.
you know.
There's a shift, but it depends. Social media is too prevalent and they are still bombarded with the images
Yes.
of what perfection is supposed to be. And then if you take that and you take them out of the context where there are enough people that are shaped like them or look like them,
Yeah,
then all the body positivity in the world.
like
And
can't.
there's almost like when I listen to my daughter speak, there's almost like a backlash against body positivity.
So it happened for like a little
It
bit, and
happened
now
for
it's
like
like,
a short
yes,
period of
yes,
time.
and
So
now it's
now it's
back.
like, you don't look good and you don't look healthy, and don't tell me that's body positivity. There's a little bit of that going on. So I don't know. I mean, I
Right, so then when the comparison images are happening, I think that's really hard to not get wired in that way, and now I'm thinking about, like, all the popular models now are back
they
to
are. We're back
yeah,
to like,
yeah, those very
the
small
yeah,
standards,
the
yeah,
wave
yeah,
standards
that's
again.
absolutely right.
But, going back to really, I mean, I feel strongly about helping all these people because I've sat with them on their journeys and, I'm in it with our own family. So,
But if you're going down and getting treatment for PCOS, for example, I think you may be able to kind of get the help with the mental health issues, get the
mhm.
help with the insulin sensitive, and then you may not ever get to that point.
Right.
Right.
That's where I'm getting to.
Yeah, yeah.
It's like, okay, write your story, take the shame out of it,
Yep.
but let's also understand what these hormones are doing, become hormone literate at any
Yes. Oh my god,
age,
that is the
you
best
know?
terminology for it.
I
Can we all
mean,
become hormone
hormone
literate?
literate,
But most
like,
of us don't until I feel like perimenopause is a
it's
time.
too
It's too
late.
late.
It's too late. You've had the babies, you've gone through your bulimia. I mean, it's too late.
Yes,
You've gone
yes,
through
yes.
80 rounds of IVF,
Yep,
like,
yep.
so if you can become hormone literate early, and for the moms, like, get your kids hormone literate. Maybe we need to be testing cortisol in children,
Yeah, yeah, more
and
commonly.
understanding like maybe there needs to be a pre-pubertal assessment
Yes.
before there's even a puberty
Yep.
assessment so we can catch these people a little bit
Oh,
earlier,
yeah, but we need, like, we need so much more studies to be
But
able
like
to
if we
kind of
keep waiting, do you think we can't get the rest of the community of clinicians on board with at least looking,
I think
even if the
yes, but cost is a
studies
problem,
true. Right.
right? So then it becomes something that some people can get,
Right.
but, like, getting out of network labs isn't.
But a cortisol level,
Yeah.
they
Oh,
can
and there's some companies that are doing, cortisol levels, like, point of, like, doing it in a
yeah.
swab you can do and, like, checking it. So there's technology that's coming.
There's technology, but there's also, like, through insurance, the clinician just has to be educated to
Yes,
order it,
that's right.
right?
That's right.
Like,
That's right.
if
And
the
then, know what to do with it.
correct. That's the second part of the story, right? So, yes, so much work to do, but I think for anybody watching and listening, if they can at least start with the story and understand that they can become hormone literate by understanding their own personal history, watching their children, kind of trying to create that foundation, like you were saying, for the hormones to live within, which is the gut and so many other things. And then moving into, okay, if we're seeing the patterns, right, and you can see the fluctuation with the hormones, get help,
Get help, exactly.
and
That's right.
like figure out what's going on there. What is there anything that shifts or changes in the postpartum period?
Oh, no, there's just, like, especially as people are delaying childbirth, we're seeing, so much coming kind of to a head when you're postpartum and perimenopausal.
Yes.
When you're having babies in your
Yes.
40s, it's like,
Right.
which one is it? It's almost like
Right.
a fun game.
Yeah.
So I think it's just I think what's hard is that women already have such a heavy mental load.
Mhm.
And I love what we're talking about, and yet so much of it still feels like it's on the patient
Right.
to, like, figure it out.
Right.
And I think unfortunately during this postpartum, that mental load just increases more
Oh,
and
totally. Yeah.
I think now more than ever, for example, the mental load is really being pushed on women. Figure out if that mascara is toxic. Figure out if those are safe
You're on the
diapers
wrong
for
diet.
babies.
Yeah.
Yeah, like, I really wish that there was more that we could do, that our kind of government would do to really help guide, help regulate supplements, for example, so then I wouldn't have to be worried about, like, does this have the active ingredient? Is this
Yeah.
one?
Yeah.
And I'm sure you do so much research to kind of figure
Yeah.
out what the right ones are, but, like, those are just, those are kind of, time sucks
Right.
that I
For women.
yeah,
Yeah.
yeah, I think that's right.
Is there anything else that until we fix, the two of us go fix the entire medical system, right? Like in the next 2 years, so that everybody has access to everything. Is there anything else that you would like the clinician to do based off what you're seeing,
Oh,
and that you would like the patient to do based off what you know?
yes, I think challenge yourself, and I always say this of, like, you learned so much in medical school, but I don't know if you were taught this as well, but it was like, things are going to change so much by the time you leave here.
Right.
Whenever you're a clinician, I think a huge thing that I'm noticing in some of the younger people that are graduating, it's like knowledge isn't fixed.
Mm-hmm.
You may have done something your whole career and you can still learn, be curious.
I learn every day.
Every single day from
Every day.
every single patient.
Yeah.
I learned from you today.
Yeah.
Stay curious and start to say, it doesn't mean you did anything wrong.
Right.
If you weren't doing it, if you weren't thinking about PCOS, if you were maybe dismissing some symptoms, but you have a chance to do it differently tomorrow, to ask those questions, to be curious. And I think there's so much that we can learn from each other. And just to be, oh, you're doing that? What are you getting from that? Let me try that. And I think that kind of perspective is what keeps medicine interesting for me, and what I think, again, continued curiosity and humility. I didn't know that, but now I might use that.
Right. I love that. That's why I love medicine still. I mean, I do think if you have that creative curiosity, you understand that there's an expanded toolbox. You understand you don't have to be so rigid with everything. Medicine's fun.
Medicine's really
It's like a
fun.
great career, and you get to see people really change. But we do have
If
a lot
you're
of
open,
you have to be open.
open to
And
change.
There's a lot of systematic stuff in place to not be open to change, to be rewarded for not being open to change, right? And for people to feel like they're gaslit, going back to how we started, at the end of this journey. I could talk
I know.
about this is
But also,
amazing.
isn't it great? Isn't
Yeah.
it great? And I think this so would inform kind of like the current situation that we find ourselves in. Like medicine challenges, but you may have been wrong.
Yeah, totally.
And now we figured something out. And isn't that so exciting?
It should be exciting.
And I'm sure you've seen that throughout your life. Like maybe I was doing this before, and then
I-
a paper came out, and all of a sudden we were proven wrong.
Right, totally. And we've seen that just in my time with the Women's Health Initiative.
Yes.
And so many different studies that were...
Oh, there's an exciting study that recently came out.
Yeah, exactly.
Yeah.
So, so much work to do, right? But I'm hoping anyone who's listened, or if they've watched this episode, at least the bell has gone off. Like, wait, there's a connection between my hormones, my PCOS, and my anxiety, my depression. Even I would throw in the inability to focus and concentrate and learn.
Yeah.
There is such a connection between all of
that's so
that.
right.
And so I hope that we've, hopefully been able to spark that. But for anybody who's like wanting more and wanting to go on that journey a little bit more deeply, how can they find you and your work, if you'll share that with us?
Of course. So Mavita Health, you can find us mavitahealth.com. We actually have an app that's available to everyone across the US, and we're about to launch PCOS focused content and community.
Awesome.
So we're really excited about that. And we also have clinical care in California, New York, New Jersey, and Texas. That's all in network.
Amazing.
So really trying to make that more accessible and affordable. And I'm on Instagram at Sarah Oreck MD, and our Mavita Health is also on Instagram at Mavita Health. So please follow us for more tidbits and information. And we're actually going to do a whole series on PCOS because it's coming out.
Oh, good. I would love to partner with you guys on that. That sounds incredible. And then final question of the day, what makes you whole?
Oh, I love that. I think conversations like this, talking to fellow women, fellow clinicians, exploring, being curious, learning new things, I think makes me whole.
Makes you whole. Well, this has been such a great conversation. I have enjoyed talking to you. Thank you for the work that you're doing. I'm
Thank
sure
you.
people will want to learn more and, really kind of carry this torch forward. And hopefully they'll spread the message when it comes to PCOS and mental health and all the things in between. And thank you all for watching and listening to this episode of Whole Plus. We post new episodes every week, so I will see you next time. Take a breath before you go. Your body's always guiding you. And if you want to understand it even better, watch the next episode on your screen. And while you're at it, subscribe so you don't miss any of the conversations that bring science and spirit together.